It's a race to the finish, both for healthcare.gov and for the uninsured, who have until midnight to at least start the sign-up process, even though some will have that extension if they start but can't finish. With the surge, a record number of calls and visits to the website over the weekend, the number could get close to 7 million. I want to bring in Representative Marsha Blackburn, Republican of Tennessee. Good to see you. Welcome back.
Good to see you. Thanks, Chris.
I know that you obviously have been critical. You want this law repealed, and not long ago you criticized the administration for falling short of a goal of 7 million. Now it looks as though they're going to come close. Maybe they'll even exceed it by the middle of the month. Do you at least think that's an encouraging sign that we are seeing people who didn't have insurance getting signed up?
Until we know what you find in that 6 million number, it is not encouraging. Look, we don't know how many of those lost their health insurance. We don't know how many got subsidies. We don't know how many are Medicaid enrollees. We do not know how many of those are actual new entrants into the marketplace. We don't know how many are the young and healthy. So we're continuing to work through this at committee. We have sent letters to all the insurance providers that are involved in the federal marketplace, trying to figure out exactly what we're dealing with. So no, it's not anything to be proud of or to crow about.
Well, it is true that it may be at least until the end of the month, if you listen to Zeke Emanuel, who's out there for the administration, until we get some pretty hard numbers, and there are certain numbers that state exchanges are not reporting. Having said that, Gallup has been following this pretty closely, and they saw in the fourth quarter of 2013 that 17.1% of Americans were uninsured. By early this year, it was 15.9%. So the numbers of uninsured are definitely coming down. Do you dispute those numbers?
Well, I think what we there again have to do is look at what you find in those numbers. And I would direct you to the 2012 Kaiser report that said 33% of all physicians are not seeing new Medicare enrollees. Now, if we have a lot of Medicaid enrollees, Medicaid enrollees, they're not expanding their Medicaid population in their patient base.
But you didn't offer that in Tennessee, correct? So those are people
let me finish my thought here, and then we'll talk about Tennessee.
Okay.
What we are doing, if we are giving an insurance card to those individuals who do not have access to the doctor, basically it's a false promise, because you say you have insurance to the queue, not to the physician. Now, the reason there was not a Medicaid expansion in Tennessee is because we have been to this dance before. It was in the mid-90s, the test case for Hillary Care. It was an abysmal failure. We have Secretary Sebelius, who has called the rollout of Obamacare a debacle. That is exactly what happened in Tennessee, a debacle. The legislature has chosen not to expand Medicaid in Tennessee, and with good reason, because they know it is not an affordable premise, and they are very concerned about the impact that would have on the access to health care within our state.
What is your belief that this is not affordable? Because this year premiums were actually 50% lower than the independent Congressional Budget Office had projected they would be. And again, I think to be fair, there are a lot of people who are saying it's going to be another year, 2 years before we get the full impact, but at least the early indications are that these costs are going down.
What you are seeing is within the marketplace with those bronze level plans, with some of the premium that is going down, but take a look at what happens with the out-of-pocket. It goes up. And those premiums are coming in below what the expectation was, but yet, Chris, they're still higher than what the enrollees were previously paying. I have not talked to more than a handful of individuals whose premium is less. They are seeing their premium skyrocket. Another thing that we have found out from our insurance brokers who are here in the area, many times if you have mom, dad, a 19-year-old, a 17, and a 15-year-old, what will happen is the 15 and 17-year-old in that family are being pushed into the Medicaid program, and then you are seeing mom, dad, and the 19-year-old put into an Obamacare, a health exchange product. So we are going to investigate these numbers and see what the numbers tell us. We're going to work through this. We look forward to not only continuing to talk with you, but talking with our constituents and our healthcare providers, our hospitals, and the insurance companies. We know actuarially, if you're not going to have the young healthy in these pools, these health pools, next year you're going to see a higher escalation in rates. A lot of my constituents will fall between having seen a 23% increase to a 700% increase in the premiums they're paying over what they were previously paying. That is not acceptable. That is not the cost coming down. That is the cost continuing to escalate what it was before the federal government got involved in the process.
Representative Blackburn, thank you for coming on the program
Good to be
again.
with you. Thank you.
Now